The storm rolled in off Lake Michigan before anyone on the executive floors of Veratex Pharmaceuticals had turned on their office lights. 14 floors below the press room, where publicists were arranging chairs for what everyone expected to be the worst morning in the company's history, Dillon Rourke was replacing a circuit breaker panel in a maintenance corridor. The kind of hallway that existed in every corporate building and appeared in nobody's architectural renders. He had a headlamp strapped to his forehead, a cold thermos wedged between his knee and the wall panel, and a photograph of his 9-year-old daughter, Katie, taped inside the lid of his toolbox. The only decoration in a workspace that nobody ever visited twice. He had been there since 4:45 a.m., not because Veratex required it, but because a fault in the emergency lighting had triggered twice during third shift, and Dillon believed in fixing things before they failed again. His colleagues called it excessive. His supervisor called it admirable while secretly relieved not to deal with it himself. Dillon called it the only approach he knew. 12 floors above him, Imogen Farrell stood at the glass wall of her office and watched storm clouds swallow the last strip of early light over the lake. She was 43, had run Veratex for 6 years, and had never once had to announce that something her company made had hurt the people it was supposed to help. Until now. The memo on her desk said it plainly: Veratex, the company's most significant drug in a decade, had failed its Phase 3 extension trial. The data was unambiguous. The patient outcomes in the treatment group were statistically indistinguishable from placebo. 3 years of development, $114 million in research costs, and far more importantly, 340,000 patients currently using it for a chronic autoimmune condition that without Veratex left most of them barely functional. The voluntary recall notice was already drafted. The FDA briefing was scheduled. The press conference was set for 9 a.m. Inside the boardroom, her chief science officer, Stuart Price, was presenting the final summary to a room of exhausted directors who had been there since midnight and who each looked like they had aged a decade since Tuesday. Stuart was precise. Stuart was polished. Stuart had managed the trial data review personally, which he said was to ensure nothing fell through the cracks. Dillon had no reason to be on the executive floor. The third-floor fault had been repaired by 7 a.m., leaving him 90 minutes before his regular shift logout. He took the service elevator up to floor 12 to check a separate electrical complaint from the previous week. A conference room panel that had been flickering during high-load meetings. Nobody else would touch it before the morning rush began. He had just finished checking the secondary breaker when the door to the adjacent hallway opened and a junior staffer rushed through, carrying an armload of printed documents, clipping the corner of his cart. A stack of papers scattered across the floor. The staffer didn't stop. She was already halfway down the corridor, phone out, talking fast about seating arrangements for the press briefing. Dillon crouched to pick the papers up. He wasn't reading them. He was stacking them, the way you stack anything that isn't yours, without really looking. But numbers had a way of catching Dillon Rourke the way sudden movement caught other people. An instinct sharpened by years he never talked about at work. One table stopped him cold. He stared at it for 3 full seconds. The page was titled Phase 3 Extension, Patient Outcome Summary, Final Revision, 2 columns, Treatment Group, Control Group. He read the rows again slowly. The numbers were wrong. Not wrong the way a typo is wrong. Wrong the way a compass reads wrong when someone has placed a magnet near it. The treatment group's adverse event rate was higher than the control group's, which was precisely what the recall memo cited as evidence of failure. But the standard deviation ranges were reversed. The confidence intervals overlapped in a way that only made sense if the groups had been labeled backward. If those labels were transposed, Veratex hadn't failed. The control group had underperformed the treatment group, not the other way around. The drug worked. The data said so, just with the columns switched. He looked up toward the boardroom at the end of the corridor. Through the tall glass panel, he could see Stuart Price at the head of the table, presentation pointer raised, speaking with the calm of a man who has already decided how the morning ends. Dillon stood there for a moment that felt longer than it was. He was aware of exactly how he looked. Work boots, maintenance uniform with a frayed left cuff, a toolbox badge with his name in 11-point font that nobody at that table had ever read. He was also aware, with a certainty that had nothing to do with confidence and everything to do with the numbers still burning in his head, that the page in his hand changed everything about the press conference 90 minutes away. He knocked twice and opened the door. The boardroom went quiet the way rooms go quiet when something unexpected enters them. 10 faces turned. Stuart Price's expression shifted from composed to irritated in less than a second. This floor requires keycard access, Stewart said. Who let you in? The service elevator doesn't require a separate card for floor 12, Dillon said. His voice was steady, though his pulse was not. I was working on the panel in Conference B. Imogen Farrell, who had been standing near the window with her arms crossed, looked at him directly. What do you need? Dillon held up the page. I picked these up in the hall. One of your staff dropped them. He paused. I think there's a problem with this table. Stewart's mouth opened first. That's a confidential research summary. I know what it is. Dillon stepped forward, aware of the wet soles of his boots on polished floor, aware that everyone in the room was waiting for him to say something embarrassing. The patient group labels in the outcome table, treatment and control. I think they're switched. For 2 seconds, no one moved. Then Stewart gave a short laugh, not genuine amusement, but the specific laugh of someone reclaiming authority. He thinks they're switched, he said to the room, voice light with contempt. He fixes circuit panels and he thinks he can read a Phase 3 outcome summary. Dillon didn't look at him, he was looking at Imogen. If I'm wrong, Dillon said, you've lost 30 seconds. If I'm right, you're about to recall a drug that works. Imogen's eyes moved from Dillon to the page, then back. She said one word, show me. Stewart stepped between them immediately. Imogen, this is... Step back, Stewart. The room became very quiet in a different way. Dillon laid the page on the table. He pointed to the adverse event column in the treatment group row. This number is higher than your control groups. That's what your recall summary cites as evidence of failure. He moved his finger across. But look at the standard deviation range here and here. These confidence intervals don't support a true between-group difference. They overlap almost completely. He looked up. The only way this data reads as failure is if treatment and control are mislabeled. A younger scientist near the wall, she had been silent the entire meeting, looking like someone who had spent the night not sleeping, leaned forward. Her name was Wei-Lin Chen, and she had been on the Veratex research team for 2 years. He's right about the intervals, she said quietly. Stewart's jaw tightened. Wei-Lin. Run it again, Imogen said. She was already sliding the page toward Wei-Lin, the original dataset, right now. Wei-Lin pulled her laptop close. The room held the particular silence of people waiting for a number to either confirm disaster or erase it. Dillon stood near the edge of the table, hands at his sides, feeling the discomfort of someone who has said the only true thing in a room full of people who needed the truth to be wrong. Wei-Lin stopped typing. Her expression changed, first subtle, then unmistakable. The summary table references the revised dataset from last week's update, she said slowly, but the original raw export shows. She checked twice. Group A and Group B identifiers are swapped in the revision. Another scientist leaned over. That would explain the entire interval pattern. Swap them back and run the primary endpoint, Imogen said. Wei-Lin typed. The room breathed badly for 40 seconds. Then she looked up, color drained from her face in the way that happened when numbers stopped being numbers and became consequences. If the groups are correctly labeled, she said, Veratex outperforms placebo by a statistically significant margin on all 3 primary endpoints. Nobody moved. Stewart spoke first. Revision errors happen in complex datasets. This doesn't change. How did the revision happen? Imogen asked. Standard update process, the data team. When? His answer came a fraction too late. Last Thursday. Wei-Lin had already opened the edit log without being asked, because she had spent 3 nights wondering why certain numbers hadn't matched her intuition and had never been given a satisfying reason. The update was made at 11:47 p.m., she said. Manual override on the group identifier field. Imogen turned slowly. Whose credentials? Wei-Lin hesitated 1 second, then said it. Dr. Price. The boardroom became still in a different way than before. Stewart straightened. I reviewed the update myself. There was ambiguity in the original export. At midnight, Imogen said. I work long hours. Dillon said nothing, but his eyes had moved to the edit log visible on Wei-Lin's screen, and something in the version sequence had caught him the same way the first table had. Not logically at first, but in that lower register where wrongness announced itself before reason caught up. That's not the first change, he said quietly. Wei-Lin looked at him. What? Dillon pointed to the screen without touching it. There's a prior version before Thursday. Wei-Lin clicked back through the version history. Found it. Opened it. The original dataset before any revisions. The original groups were correctly labeled. Veratex worked. The data had been accurate until someone manually reversed two identifiers at 11:47 p.m. on a Thursday using Stuart Price's credentials from a workstation registered to his office. Stuart folded his arms. His voice dropped lower, controlled but thinner now. That proves nothing except that I corrected what I believed to be a labeling inconsistency. And submitted a recall recommendation based on the reversed data, Imogen said. I submitted based on what the data showed. The data you altered. Stuart's composure cracked at its edge, small, almost invisible. But Dillon saw it. Wei Lin saw it. Imogen, who had worked alongside Stuart for 4 years and trusted him with the single most important asset Veratex had built in a decade, saw it with something that looked like grief underneath the shock. She laid both palms flat on the table. No one leaves this room. Her voice had changed, not louder, harder. Fully CEO again. Wei Lin, rebuild the corrected analysis. Legal needs to be here in 10 minutes. She looked at Stuart. You don't speak without counsel present. Stuart opened his mouth once, then closed it. Dillon stepped back toward the wall, unsure whether he was supposed to stay or leave. The answer came before he could ask. You too, Imogen said, without looking at him. Whatever you are, stay. What followed felt less like a corporate meeting and more like surgery performed under bad lighting. Every analyst with clearance was called in. Wei Lin rebuilt the complete outcome summary from raw exports. Legal flagged the edit log. A Friday morning backup showed Stuart's credentials accessing a secondary terminal at 2:19 a.m. 3 days before the official update, querying the dataset structure in ways consistent with someone studying how to reverse a label without triggering automatic validation. Each discovery arrived quietly. Each one narrowed the space Stuart had to stand in. Imogen asked once, during a brief pause, why Dillon had been looking at the table at all. It fell on the floor, he said. And you just happened to understand what you were looking at. He was quiet a moment. The numbers felt wrong. She studied him. Numbers don't feel wrong to most people. He looked toward the window. The storm had thinned, and pale gray light was pushing through in streaks over the lake. They do to me, he said. Why? This was the part he didn't give people. Not his supervisor, not Katie's teachers, not anyone who hadn't known him before his life had become this particular shape. I was in a doctoral program, he said finally. Biostatistics. University of Minnesota. Left during my 3rd year. He paused. My wife got sick. Lymphoma. I left to work full-time while she did treatment. Then after she passed, my daughter needed. He stopped. Not from pain exactly, but from the discipline of someone who has learned to carry heavy things without setting them down on other people's tables. She needed me available. Not ambitious, available. Nobody in the room spoke. Katie's 9, he said. Not because anyone asked, but because saying her name out loud at this distance from her made her feel less far away. She takes the bus to school, but she doesn't like to, so I usually meet her at the stop when my shift ends. Imogen glanced at the clock, 8:24. She turned toward her assistant, who had appeared in the doorway 2 minutes earlier, with the careful expression of someone who understood this was not a normal morning. Call Ridgeline Elementary. Tell them Katie Rourke's father is delayed on an urgent work matter and ask her teacher to walk her inside personally. Dillon looked at her. You stayed, Imogen said simply. It cost me a phone call. Stuart laughed once, dry, hollow. Are we restructuring a federal recall decision around a maintenance worker's childcare schedule? Imogen turned toward him for the first time in several minutes. We're restructuring a recall decision around correct data. You should be more concerned with which of those two things is the bigger problem for you right now. Stuart had no answer, which Dillon noticed was the most revealing thing he had done all morning. The room was deep in legal review when Wei Lin called out again, voice tight. There are outbound transfers, she said, from the auxiliary licensing account. Beverly Cross, the legal counsel who had arrived 12 minutes ago and had not removed her coat, looked up immediately. What transfers? 3 payments, listed as external consulting. Wei Lin stopped. Checked twice, total of $14.3 million. Consulting for what? No deliverables attached, no contract summary visible. Stuart said nothing. Who received the funds? Imogen asked. Wei Lin found the entity name, Carrington Scientific Advisory Group. Dillon looked at the transfer timestamps without meaning to. The same midnight pattern, the same narrow window between Thursday's data manipulation and the Friday morning recall recommendation. When were those transfers initiated? He asked quietly. Same week as the data revision. Beverly was already on her phone. Dillon spoke carefully. Is there a way to check who controls Carrington? Wei Lin pulled the corporate registration, young entity, 18 months old. Filed under a proxy structure, the registered address matched a Chicago legal office. The Chicago legal office was affiliated with a company called Gentrex Biologics. Gentrex Biologics had made a formal offer to license the Veratex patent 6 months ago. Imogen had declined. If Veratex recalled Veratex, the patent's value collapsed, and Gentrex could acquire it through distressed asset terms for a fraction of its actual worth. No one said it first. They didn't have to. The math was simple enough that everyone arrived at the same place simultaneously, including Dillon, who had a particular relationship with math that made silence in rooms like this feel louder than other people found it. Imogen sat down. It was the first time she had sat since Dillon entered the room. He didn't make an error, she said quietly, not to anyone specific. He manufactured a failure. Stewart stood abruptly. I want independent counsel. Beverly is right there. Separate from Veratex. You'll have it. She nodded toward the 2 corporate security officers who had been standing near the door for 30 minutes waiting for direction. Conference room 6. No devices, no outgoing calls. Stewart looked at Dillon once before the officers reached him. The look was not embarrassment. It was the specific expression of someone whose plan has failed and who needs to assign the failure somewhere. He settled on Dillon, which was convenient because Dillon was there, and Dillon was the reason. Dillon met the look and said nothing. The door to conference room 6 hadn't closed 3 minutes before Wei Lin found the secondary problem. A parallel dataset, a pediatric cohort, Veratex extension study in adolescents with the same condition. The results showed meaningful efficacy, consistent with the original unaltered primary trial. That dataset had not been included in the recall recommendation at all. Beverly looked at it for 15 seconds and then made a call to her FDA contact. The government briefing that had been scheduled to confirm the recall became instead a briefing about potential data fraud in a pharmaceutical recall process. Imogen asked Dillon once more to look at something. A summary table from a 2022 interim review that had always seemed inconsistent with the later data. He looked at it for 4 minutes and identified 2 additional labeling irregularities in subgroup analyses, both of which compressed the treatment effect estimates in ways that made the drug look weaker than the underlying data supported. These weren't Thursday's work, Wei Lin said, checking the dates. Dillon shook his head slowly. These go back further. Beverly straightened. How far? Wei Lin pulled the full version history, 14 months. Stewart had been systematically softening the interim data for over a year, building a story of marginal efficacy that would make the final failure look credible when it came. Not impulsive fraud, patient fraud. The kind that gets planned in the margins of certainty and executed in the small hours when the building runs on backup lighting and maintenance crews who nobody watches. Imogen called the board chair directly at 10:18 a.m. The emergency session convened at noon. By then, Beverly had what she needed. The FDA contact had initiated a formal data integrity review, and the 9 a.m. press conference, delayed with a brief statement about new information requiring evaluation, would not be rescheduled as a recall announcement. Dillon stood near the back of the boardroom when the vote ended. 8 directors in favor of suspending all recall proceedings pending investigation, 2 abstentions. The motion for emergency external restructuring authority, submitted by Gentrex's legal team before the session even began, anticipating a company in chaos, was tabled under fraud review. Stewart Price was suspended pending criminal referral. The room dissolved slowly. Legal counsel remained. Analysts gathered files. Board members approached Imogen one by one with words that arrived about 3 hours too late to matter the way they wanted them to. Dillon moved toward the door because, now that it was over, he no longer knew whether he had a place in the room. He found out before he reached the handle. Mr. Rourke. He turned. The boardroom had emptied to just the 2 of them, and afternoon light was coming through the west-facing glass in long, flat columns, the way it came in December when the cloud cover broke all at once. Imogen held a folder. She crossed the room and stopped a reasonable distance away, not performing formality, but respecting that he was still technically in his work uniform, still had a headlamp in his jacket pocket, still had concrete dust on his boots from the maintenance corridor hours ago. She placed the folder on the table between them rather than handing it directly. Inside was 1 page, Senior Research Integrity Analyst, Veratex Pharmaceuticals. Dillon read the title, looked up. My degree is unfinished. The position doesn't require a finished degree. It requires someone who can read data the way you read it this morning, and who won't be convinced by anyone in an expensive suit that numbers say something they don't. He looked at the page without picking it up. My daughter is out at 3:10, he said. I need to be there. Then be there. When she's sick, I leave. No advance notice, no explanation required. Understood. He was quiet for a moment, looking past the folder at the surface of the table. Then, the overnight maintenance team. Hendricks, Boyle, and Liu. They've been on the same wage band for 4 years with no classification review. Veratex has a capital expenditure surplus that could fund it without touching operational budget. Imogen's head tilted slightly. I filed the facility reports, Dillon said. I read them too. I'll have HR pull the data by end of week. And Veratex patients who lost coverage during even a 30-day recall delay, some of them will have paid out of pocket for alternatives already. Someone should make that right. Imogen studied him for a long moment, measuring something that wasn't on any of the spreadsheets still open on the monitors behind her. You came in here to fix a circuit panel, she said. The circuit panel is fixed, he said. It's in the log. Something crossed her face, tired, genuine, almost a smile. She slid the folder 1 inch toward him. He didn't sign it then. He folded it once and placed it in his jacket pocket, on the side away from the headlamp. Outside, December had gone cold and sharp the way Chicago went cold when the lake storms finally cleared, painfully bright, the skyline catching light it hadn't seen all morning. Ridgeline Elementary let out at 3:10, and at 3:08 Dillon Rourke was standing at the edge of the parking lot with his collar up and his hands in his jacket pockets, watching the double doors at the far end of the building. Katie came out in a green coat that was 1 size too big because she'd grown and he hadn't gotten around to replacing it yet. She was carrying her backpack in one hand and her lunch bag in the other, because she had never figured out how to wear the backpack and hold things at the same time. And he had never corrected it because watching her solve the problem her own way was one of his quiet daily pleasures. She spotted him and moved faster, not quite running, the way kids move when they're trying not to look like they were worried. You didn't come to the bus stop, she said. Big day at work, he said. She squinted at him the way she did when she suspected the answer was insufficient. What happened? He crouched down to her level and re-zipped the snap on her coat that had come undone in the cold. I noticed something that needed to be fixed. Like a broken thing? More like a wrong number. She considered this with the seriousness she applied to everything. Did you fix it? He looked at her. The gap in her front teeth, the line of her part that was always crooked because she did her own hair now and wanted to, and felt the specific tiredness of a day that had been enormous alongside the specific gratitude of having something small and true to come back to. Yeah, he said, I think so. She seemed satisfied with that. She transferred her lunch bag to her other hand, and they walked toward the car together, and she told him about a science project due Friday that she had not started, and he told her they would start it after dinner, and the conversation moved in the easy, unremarkable way that ordinary evenings did when they belonged only to them. 14 floors up, Imogen Farrell stood at her office window and watched the parking lot empty below. She did not know which car was Dillon's. She did not need to. She turned back to her desk where the corrected Veratex analysis still glowed across 3 monitors, and where 340,000 people who had no idea what this morning had held would take their medication tonight without interruption. On the corner of her desk, the recall announcement sat in a manila folder. She picked it up, folded it once, and dropped it in the shredding bin. Then she started the work of rebuilding a company that had nearly been taken apart from the inside. Correct number at a time.